Pharmacy exam MCQs. So the first question is, alteplase is less likely to cause systemic bleeding than urokinase because the options are it only activates thrombin that is associated with a clot, it has more specific effects on platelets, it is a recombinant protein, it only activates plasminogen associated with a clot, urokinase is extracted from hemolytic streptococcus that causes bleeding. So here the answer is option D, that is, it only activates plasminogen associated with a clot. Alteplase is a recombinant form of tissue plasminogen activator that requires plasminogen to be bound to the fibrin of clots before it can cleave to plasmin. Urokinase is able to catalytically activate free plasminogen to plasmin, which can lead to generalized dissolving of clots and a systemic bleeding or lytic state. All of the following agents have actions on blood platelets to modify clot formation except options are eptifibatide, dabigatran, clopidogrel, dipyridamole, tirofiban. Answer is option B, that is dabigatran. Dabigatran does not interact with platelets but rather inhibits thrombin directly to reduce clot formation. The amount of dietary cholesterol absorbed from the gastrointestinal tract is reduced by options are niacin, rosuvastatin, acetamide, clofibrate, cholestyramine. So all these are anti-hyperlipidemic agents. So out of these, we need to find out the drug that reduces the amount of dietary cholesterol absorbed from the gastrointestinal tract. So here the answer is option C, that is acetamide. This acetamide specifically interacts with the sterol transporter on the gastrointestinal epithelial cells to reduce the absorption of dietary cholesterol. Angiotensin converting enzyme inhibitors, that is ACE inhibitors, such as enalapril are prodrugs. What is the purpose of the prodrug formulation of enalapril? Options are to enhance the potency, enhance oral activity, mask taste, enhance water solubility, increase stability. Answer is option B, that is to enhance the oral activity. Enalapril has an ethyl ester that covers a required carboxylic acid. After ester hydrolysis, the active drug enalaprilat is released to inhibit angiotensin converting enzyme. By covering the ionic carboxylic acid functional group with the more lipophilic ethyl ester, the oral bioavailability of enalapril is enhanced. Prodrugs can also be used to mask a foul-tasting drug, enhance water solubility, or increase the stability of a drug, but this is not the case with enalapril. All of the following agents can be used to manage atrial fibrillation except options are verapamil, lidocaine, dronedarone, propranolol, quinidine. Correct answer is option B, that is lidocaine. The relative specificity of lidocaine for sodium channels results in little nodal inhibition, so fibrillation due to SA or AV nodal activity would be unaffected. Lidocaine also has little effect on atrial myocardial cell depolarization because its sodium channels are only in the inactive state for very brief periods and so would not be effective against ectopic atrial arrhythmias. Overall, lidocaine is not effective in the management of supraventricular arrhythmias unlike the other agents on the list. So thanks for watching. Have a great day.